What are the different types of birth control pills?
Well, when it comes to birth control pills, there are two different kinds. The most common types are combination pills. They contain estrogen and progestin. Consistency is the key. You want to make sure to take the pill every day, and combination pills come in different pack sizes. There are 28-day packs, 21-day packs, and 91-day packs. The 28-day packs contain 21 active pills and 7 inactive pills. These are the most common. The 21-day pack contains 21 active pills, and then you don't take any pills for 7 days. The 91-day packs have 12 weeks of active pills and 1 week of placebo pills. With the 91-day pack, someone would have a period only once every 3 months.
That's a lot of numbers, a lot of packs, and a lot of.
Just think of it as, think about it as 1 month, 3 months.
1 month, 3 months, okay.
Yeah.
And the placebo, what is that about? Why the placebo?
Just to get you in the habit of doing it every day. So, like a lot of times people who have the placebo just leave them there anyway. So just to get you in the habit of taking a pill every day. So the 28-day and the 21-day, if they're both combination pills, are going to be the same thing. It's just one has placebo in there and one doesn't.
Got it, okay. And is there anything else you need to consider with these types of pills, Dr. Lia?
Well, you want to make sure that you're taking them correctly. If so, this is a reliable birth control method. It can also help regulate periods, reduce menstrual cramps, and help with hormonal acne. Just keep in mind that it requires daily attention, and combination pills can cause side effects like nausea, breast tenderness, or mood changes.
Ooh, mood changes. We don't want that.
I think some of that's like played out. I think some of that's placebo effect. Same thing with weight gain. So like the hormonal pills used to have quite a bit of hormones in it, like in terms of dosage, much more, and that used to cause weight gain, but it really is not as bad as women are saying.
And what about other types of pills?
Well, there are combination pills, and then there are also progesterone-only pills. With these pills, they have to be taken within the same time window every day to make sure they work. Otherwise, the risk of pregnancy increases. Progestin-only pills usually come in a 28-day pack, and they don't have any placebo pills. There are also newer progesterone-only pills, Cislindi, and it offers more flexibility. And it comes in a 28-day pack with 24 active pills and then 4 placebo pills. These types of pills would be good for someone who can't take estrogen, and it could also be good for someone who's breastfeeding.
And what's the difference between progesterone and progestin? Progestin, am I pronouncing it right?
It's really quite simple. Progesterone your body produces. Progestin is what you're taking in a pill. Okay. So it's one's synthetic and one's natural.
Okay. Is anyone better than the other?
Well, it's not like you could choose. Your body's either producing progesterone or I'm taking progestin, you know. So it's either natural or synthetic. Yep.
Okay, great. So how do you know which one to take?
Well, it really depends on the person. People with certain health conditions might be told not to take estrogen-containing pills. And if scheduling is going to be an issue, taking the pill at the same time every day might be challenging. So the combination pill or the newer option, Cislindi, could be easier to manage. Of course, you want to consider the side effects. Typically, these vary from person to person, so talking to your doctor will be the best way to figure out a good option for you. And with age, it can be even trickier to find out the best option. One doctor explains how to navigate your choices.
Birth control is one of those things that women tend to start not worrying about a little too soon, perhaps in their 40s, and that is too soon. We find that in most of the research, by the time a woman reaches the age of 55, she is 95% likely to have gone through menopause. Menopause is defined as 1 year of no periods. If you reach 11 and a half months of no periods, then have a period, the clock starts all over again. Previous methods of contraception have kind of been scrutinized in terms of usage in women who are around the time of their menopause transition, and some are considered safer than others. But now we have a lot of different options for women, but there is no specific contraindication for a method of contraception based on age alone. It's that kind of mixture of medical conditions, preference, what she really wants to use, as well as what works for her in terms of convenience and what she will actually use. Now we talk about IUDs a lot, as well as implants a lot. They don't have estrogen, so they are safer from that perspective. However, if a woman is healthy, has normal blood pressure, doesn't smoke, and is generally in good health, she can continue using estrogen-based contraception, including pills, patches, and rings, well into her 50s until she is ready to either transition to hormonal therapy for menopause or not, and it works perfectly well. The hormones that are in menopausal hormone therapy are at a much lower dose than you would have for a birth control pill, for example. So many women who are not able to use combined hormonal contraception, so pills, patches, or rings, things that do contain estrogen, are able to take menopausal hormone therapy and know they will not get pregnant based on that. For example, progesterone IUD combined with menopausal hormone therapy estrogen is a wonderful way to cover both bases. The mini pill, progesterone-only birth control pill, plus menopausal hormone therapy estrogen is a wonderful combination for perimenopausal women who are just trying to cover both bases. Implant plus menopausal hormone therapy estrogen will work very well as well. So you get the idea that you can kind of cover both bases until you are very comfortable that you are not going to get pregnant, and yet you can treat hot flashes, night sweats, all the menopausal symptoms that you need to.
There seems to be a lot of factors to consider, right?
Well, exactly. And this is why it can be so important to have a conversation with your doctor so they can help figure out what is the best for you at any stage of life.